This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
So welcome everyone, I'm Dr. Ron Hunninghake, and this is the Real Health Podcast again. And I have as my guest, Dr. Mark Sherwood, who is a functional medicine doctor. You're down in Oklahoma, is that right, Mark?
Yes, sir. Tulsa, Oklahoma.
Tulsa, Oklahoma. And your area of expertise is functional medicine, I understand.
Yeah, I would agree with that. My wife and I, Dr. Michele, who could not be here today, I want to acknowledge her. She's my spare rib. She's my prime rib. So I just like to address her as that, right?
Yes.
But yeah, we've been in this space for the better part of the last 20 some odd years and have been doing it a long time. So we've been trained in functional medicine, hormones, peptides, age management, the whole bit.
Yeah. And you went to naturopathic school?
I did. Yes, sir.
Which one?
Well, I did mine overseas because I was older. And so I started school when I was 42, believe it or not. So some people say it's too late to learn, but I didn't think so. I was like Forrest Gump in the movie, Forrest Gump. I just kept studying and studying and studying and never stopped.
Well, our daughter did a year of naturopathic school, and she probably would have finished, but she met her husband, and they moved back to Atlanta, and there was no naturopathic school, so she became a chiropractor.
Well, there you go. That's cool.
So, and I'm a family physician myself, but I was fortunate enough to meet Dr. Riordan, who was very instrumental in starting functional medicine back in 1975. And so the whole concept of functional medicine was for me the missing piece in regular medicine. It's great. I mean, I'm very much into integrative medicine now because our other son is he's an MD. But, you really need a little bit of both. And so in order to make sure you get by, because this is a really tricky world these days. And what are some of the patients that you're seeing, and what are you doing to kind of help them function better?
Well, again, I couldn't agree more. We have to really blend the best of all worlds at this point. That's called wisdom. We don't need to say this is bad or that's bad. It's all good. I figure knowledge is great, but we don't know how to apply it. That's a lack of wisdom. So the bottom line is we see people that I think as their general vibe, Ron, that have came to us that are frustrated. They're frustrated in one side or the other. And they're looking for someone to bring it together, to put it all together, to integrate those principles in one. And a lot of them have probably been, as they state, misunderstood perhaps in conventional medicine. And on the other side of the coin, they went to the quote unquote all natural route, and they haven't found their questions all answered. And so it's the combination of both. And we've been able to sort of listen to them as the whole person and like a 500-piece jigsaw puzzle, start putting it together where they can begin to have the idea, the vibrancy of life, and really understand who they are.
I think that idea of just listening to patients, I remember back in my early days, I wasn't doing functional medicine, and it was a 10-minute appointment, and you really could only get to what was the problem. What was the problem? Okay. And so doctors become symptom problem solvers, but not necessarily root cause problem solvers. And so how do you and your wife navigate to the root cause of a patient that when they come to you?
It's very interesting when someone comes in, and we don't start out with what's your main complaint. And we purposely do that because I don't want them focusing on the negative. It's like, okay, in a system of the humanity, whatever, the human body, there could be one or two things that are not functioning right, but there may be 99 other things that are. And so we sometimes focus too much on the wrong and miss the right. So in our initial conversation, we start the conversation and interaction out with, tell me about your life. Tell me about your family. Tell me about your kids. Tell me about your dogs. Tell me what you like to do, what you don't like to do. Tell me how you live your life. I want to know a typical day in the life of Ron, and so that helps us understand who the person is. And it's interesting in that initial dialogue there, Ron, where they you see the barriers come down. And it's fascinating because they begin to sort of perhaps experience trust, and good things happen in a trustworthy environment. And then we're very careful about how we phrase what might not be going so well. And that's kind of how we say it. So could you tell us, of all the things that you've got that are going great, give me a couple of things that don't seem to not be going great? And we kind of like soften the blow of that. And then we come back when we hear that, we rephrase it back, and then we sort of reframe it back by saying, well, when you get this corrected, what would that do to your life at that point? Give me that vision. So we went from here to the low side, and then we finished up with this vision. And so that's been kind of our flow through that initial patient interaction, and it sort of sets the tone for the rest of the interactions and hopefully the experience.
Yeah, a lot of people approach doctors from a perspective of fear, just what you just said.
Yep.
And when you're in that, you tend to feel inadequate. And that's why I think a lot of doctors seek out, or a lot of patients seek out doctors, is because of their own feeling of inadequacy as to what to do about this or that symptom or this or that diagnosis. Diagnosis is even scarier because it's almost like you're stuck with this now, you're labeled. And so I really like what you're saying, that you're beginning to look with the patient as to what resources they actually have that they're bringing to the table. So then where do you go?
Well, obviously we will draw the diagram or the visual picture in their head, like here is systems biology and here's conventional medicine. And when conventional medicine is, here's your group of symptoms going through the algorithm and here's your medication, right?
Yeah.
We're going to look upstream. We're going to look for the root causes of what might not be going so well, correct that. So therefore the symptoms go away, and then the diagnosis becomes irrelevant at that point, right? And so we start off with the lifestyle pieces, and make no bones about that. We start off with nutrition, sleep, stress management, movement, perhaps supplementation, and perhaps what they're missing, and just bring it all back together, because we've seen this too many times, whether it be functional medicine or whatever. The foundation is not correct, and then you start stacking on the foundation, and it's like trying to build a house upon an inadequate or imbalanced or cracked or improperly laid out foundation. So we start off there and try to establish good groundwork, good habits, a good plan that's personalized to meet them where they are. And we know that lifestyle change is not that easy for some people, but we also celebrate the victories. So depending on who they are, how they are, some people can go, 100 miles an hour, and some people have to go like 5. But we set a tone and set a plan with benchmarks. And some of the benchmarks we use that seem pretty basic, but we'll look at comprehensive lab work. But I like to look at body composition. We'll use our in-body and DEXA scans, because we don't want to have excess visceral fat or even excess fat, period. We want to have maintenance of bone and muscle and a good ability to cognitively perform. And so those are our benchmarks, to be able to do what you want, when you want, how you want, as much as you want, and not hurt. And so if we can get that established, that's kind of our initial process. Then we go upwards from there, of course.
Yeah, the way Dr. Riordan did it and the way I try to do it too is that we refer to our patients as co-learners.
Yeah.
And when I first asked him about, well, what does that really mean? And he said, well, as a doctor, we may know a lot about something that this patient is concerned about, but we don't know how that affects this patient.
Right.
And so opening up to understanding the patient, and then delving into, okay, what are root causes? What are the factors that could be perpetuating symptoms? The symptom is really oftentimes just a cry for help. But if you just treat the symptom, you may be missing the cause. And so what you're saying is you're using resources to investigate deeper into what might be underlying causes of why the patient is experiencing what they are.
Yeah, certainly. And I think that one of the things that we probably try to do consciously, we don't say it all the time, but we do all this time consciously, is we try to love them. I mean, that word love goes a long ways. It's like loving them enough to listen to them. And I figure that we've been given 2 ears and 1 mouth for a reason. And we as doctors, we're very well-studied people, sometimes too much so, in a sense that we want to communicate how smart we are, but yet sometimes we can be more intelligent by just listening. And you're right, Ron, when you know that person and you find the bridge of communication, I teach the staff this, and my wife and I do this. The first question we ask to them when we see them is how's your dog, or how's your latest fishing trip, or how's your husband or wife, or how's your kids, or how's that father of yours doing, and so we build those bridges right there about caring for them as a human being before we get into the the nitty-gritty stuff.
Yeah, it's funny sometimes. In medical school, I was just thinking back. I don't remember hearing the word love too much in medical school, and I think I understand that because as doctors we have a bit of an awesome responsibility in terms of how we work with patients, and I know doctors want to do a good job. They want to help the patient get well. But it's scary. It's scary when you're dealing with someone with cancer or with another life-threatening illness. You've got a lot of responsibility in your hands, and so I think there's a certain fear that doctors have of maybe not being able to be up to whatever that particular patient has to deal with. But I think if you start with the common denominator of, hey, we're human beings. We're doing our best we can. As a doctor, I'm going to do my best for you. I know you've come to me for help, but I hadn't really thought about that, that maybe, of course, there are some patients always says, boy, I love you. They just get up and go out of the room. But you're saying it's not that. It's not just saying it's feeling it, that a compassion and an identity that we're all patients in a sense. We're all trying to discover what we can do to heal our ailments. And so, but I like what you're saying.
Yeah, it's very important that they experience and feel that love, and it's more about what you do than just saying the word.
Right.
It's given in eye contact. It's open hands versus sitting with closed arms. It's the body language. It's the environment. It's the whole ambiance of the moment. And if they sense that, and I think we all would agree that when a person's in a position where they're not feeling well, they want to get heard, and they want to feel like and believe in their heart, not just a feeling. They want to believe that you care, and whatever means that we do that to make them believe that we do care, even though we do, we just got to work on the vehicle or the language, if you will, to get them to understand that. That's the biggest win you can get with a person. And I get it that overwhelming burden that we all have. We don't want to mess up. We don't want to make the wrong call. We want to do the right things. We don't want to lose one patient. We want to see every one of them get completely, utterly healed. And it's heartbreaking when it doesn't happen sometimes. And that just rips your heart out. But I think that makes us who we are. Gifted people in that area of, quote unquote, being a healer.
What would you say is the biggest challenge you're facing these days in terms of patients coming in and talk to you? There's so many things going on right now. The escalation of chronic illness is, I think, unprecedented. What are some of the things that you're dealing with?
Our illnesses, chronic illnesses such as type 2 diabetes, such as Alzheimer's dementia, such as autoimmune conditions. I'll call it obesity. I think that's a chronic illness as well.
Right.
The cancers. These are at a place in time right now in history where I don't think it's ever been even close to matched before. And I look at our society, and what we're doing is not a very good job. And so we can do much better. And I think that's the kind of persons we're seeing a lot, and we try to get them in a place of belief that things are reversible, things are curable. And you mentioned diagnoses, and I think that's important to be a good diagnostician, but they've been labeled. And when that becomes something that I am type 2 diabetic, or I am, that changes who they are inside. And so that whole system that we have, Ron, it needs to change. And so my wife and I have been out there on that edge for a long time, and trying to change that, because I don't want them to say, for example, I'm a diabetic. I don't want to hear those words. And sometimes I correct them. Hold on, let me just help you with something. I am living a life conducive with healthy blood sugar. And that shift like that helps them sort of in their own world take charge of their health again, because you're right, they've been disempowered, or they have had their confidence ripped out from underneath them because of a system that wasn't really bent on correction, but was bent on management. And I think that's a real delineating factor there between, what we do and what the system does. We need the best of both worlds. Don't want to throw shade at one of them and dismiss it because it's not right. But that's the kind of persons we're seeing. But our clientele has really morphed, I would say, over the last 8 to 10 years into this 45 to 65, 75 person years of age that want to do better, that want to get a hold of their health, that are more the aggressive, like, tell me what to do. Tell me how you can do this. And my wife and I have taken it very personal in the sense that we've got to be good examples for them. And it's become more or less of a community of people that really want to walk the talk, be the hope. Funny, we wear these little bracelets that we give out called hope dealers. And so I think people really enjoy that, got them on right there. And people really enjoy that. They become part of dealing hope to somebody else in their families. And I've also understood too, my wife and I, that if we do our job well, physicians as teachers, the students become good teachers. And you really have to get a hold of that one, because I want the citizenry now. I don't want them to be just a lay public that doesn't know about health. I want them to be the lay healers that know a lot about health, that are studying it, because information is not proprietary anymore. It is out there everywhere. Misinformation as well, quite frankly, but they need to know the difference.
We have 3 naturopathic oncologists on our staff, which we are very blessed in that regard. And one of the things that's come along with naturopathic oncology is this idea of terrains within the body. Yep. And I find that to be really helpful with patients, because they'll if they have a diagnosis, you've got cancer. Okay, yeah, and they can even tell you where it is, which organ it is, but they can't tell, the doctors can't tell them why they have it. Right. And more often than not, people will kind of like blame themselves for having the disease. And that doesn't help. I believe in being responsible, take responsibility for what you're working with. But our job really is to help them find ways to improve their likelihood of getting well. If instead of just treating the problem, what we're going to do is help you build your health. And with the idea of terrains, it gives you some specific target areas. The gut microbiome, for instance, is an example of a terrain that I think people are really starting to understand, what you eat, the whole idea of probiotics, and how different foods have different effects upon the gut microbiome, and how you can start to make better choices in a way that empowers your gut microbiome, and that so much of your health depends upon that. But that's something you can do. You can't give yourself chemotherapy, but you can sure take better care of your gut microbiome. So helping people get grasps of these different domains within the body, terrains within the body, can be really helpful for people.
Yeah, I'm a big supporter in that concept, that the idea of the environment in which you are, the environment in which, even when you look at the idea of cancers, what is that? In a sense, is it initially, is it the cell that has become cancerous? Is that crying out to the environment, the terrain that it's in, to say, come fix me, correct me, or kill me? Or is it that the terrain went bad, and because the terrain went bad, the cells became able to become dysfunctional? So, we're always talking about this with our patients. And to your point about the gut microbiome, there is no question in my mind that the greatest border security we need to have today is right here in our mouth, and probably right behind that, our eyes and our ears and our hearts, And so when you put stuff in here, it's no wonder that our systems are constructed with the majority of our immune system being around our gut, because that is the area that has to make the decision. Do I like you? Do I not like you? Are you waste products? Am I going to keep you? And what am I going to do with you? And so we've got to get that right. And so we've kind of taken a no nonsense, no compromising approach to that, because if a gut is dysfunctional, if a gut is, i.e., specifically leaky, I mean, you're talking about leaky gut, leaky brain, leaky system, leaky cells, that kind of thing. So I want that gut to be right. And we're always working on that, whether it be through looking at various testings to determine what foods are creating the most nightmarish inflammatory action right now, how leaky is the gut, looking at markers like zonulin and things like that, looking at the gut microbiome, the stool testing. I'm a big believer in that too. The same time, we've got to look at the emotional component of that, because of stress. We know when stress goes up, cortisol goes up, one of the effects in our gut, we get more leaky. We see athletes that I've got a few NFL guys that we work with, and I see athletes have notoriously predictable leaky guts. And it's because of that intense exercise they have. So this is a big deal. And so we are always talking about the terrain or the environment in which we live. And we always talk about how that environment in which we live affects our metabolomics, our genetic expressions. And so putting that all together is more complicated than any chess game I've ever played. And the more we learn, I think we'd both agree, the more we know we don't know. And that's the curiosity behind it. And we sort of got this idea a long time ago that the curiosity is what really brings healing into the human. And I think that's probably true.
Another big terrain is PTSD. I see a lot of patients who are carrying heavy guilt, and they think their disease, whether it's cancer or whatever, is a kind of punishment. And I don't always get around to this. Sometimes this is the last thing that comes up, but maybe still the most important is a kind of, hey, forgiveness. I mean, this almost sounds like it's a religious experience, but it's not religion. It's body forgiveness. Yes, we've all made wrong choices and done things, and things have happened to us. But today is a new day. Let's start by, don't punish yourself by making wrong choices. Make better choices so that your body will be healthier, and so you can have that kind of healthy kind of forgiveness.
Yeah, that's an area that we're passionate about. I happen to be a Christian, but it doesn't make me superior to anybody else.
Right.
And so, and I'm sort of anti-religion, because I looked at religion as man's best attempt to reach God. Good luck with that one, right? But the bottom line is, we've coined a phrase a long time ago, is frauds. It's an acronym: fear, resentment, anger, unforgiveness, disappointment, and shame.
Wow.
Those are the biggies. You lose who you are. You forget who you are. You become your disease. You become the diseased. And we live in this perpetual cycle. And this is previous career. I was in law enforcement for 20 years and 10 years on the SWAT team. So I've seen people die in front of me. And that's hard. You don't forget the images. You don't forget the trauma you go through. And even from a personal standpoint, I've dealt with suicide ×2 in my life, and so everybody's got a story. And I think that people need to know that even the clinicians have a story.
Yeah.
But that whole idea of post-traumatic stress disorder or trauma disorders or the infection of trauma in our lives, it wherever it became a root, it needs to be extracted. And we need to get the idea of that we don't have to live in that. We don't have to become that. Even though, and this is one of my criticisms, if you will, of that section of medical care, is that we put these psychological diagnoses on there, and it almost becomes an excuse. It almost becomes the reason. It almost becomes a hook as to why they can't, And so we've got to sort of restructure that. And so it's not unusual for us to do a fraud assessment, and I might not go through their fear, resentment, anger, unforgiveness, disappointment, shame, but I'm sure going to go through those questions about what I hear them saying. And I'll just give you one example. You have a mom with two daughters, one's skinny and one's not. And one comment by a mom or dad one day, like, can't you be more like your sister, can set the tone for the bitterness, the anger, the behaviors that keep the person holding the excess fat tissue in their frame, much like a protective blanket. You're not getting close to me, and it can destroy everything they do, not just the relationship with other people, but relationship with themselves and food and life, etc. So we're very passionate about that. And so we've been very, some would say probably too much. And I would say that's fair, but we not afraid to bare our souls, a little bit sometimes to people. My wife, interestingly enough, was kicked out of modern medicine because too many people got too well. And she's a board certified internal medicine, board certified sports medicine, and very intelligent. She's smarter than I am and more beautiful as well, But how do you get past that? And we tell them that's the birth of the Functional Medical Institute.
Exactly.
It's like when one door gets slammed in your face, or you have one traumatic event, or 2 or 3 or 10, that can be the end of something. I get it. But if we look at it in a really cool way, it can be the beginning of the rest of our lives. And so I think that's a super important subject to get, because you go back and look at Chinese medicine principles, which has got some awesome things about unforgiveness and how that can affect detoxification and anger and all that, and cancers. I think there's probably something to it that we probably don't fully understand at this point.
When I first started with Dr. Riordan, he was there was about 8 psychiatrists in North America that broke rank with psychiatry, and they were doing what was called orthomolecular medicine, because they found they could use nutrients at higher levels. But the first thing he had me do when I started with him is go to a course on holistic medicine. So I'm board certified holistic doctor. That was a real eye opener to really understand that if you're dealing with the whole person, you have to deal with the whole person, not just their biomedicine component, which is fine. We are a biology, but we also have feelings, and we also have a spiritual dimension. Even an atheist can be spiritual.
Yes.
So the spiritual dimension is not a religion. It's dealing with that part of ourselves which understands that there is something bigger than us. And when you can connect with people on these different levels, you find out that oftentimes the roots of the illness go that deep. And I admire the fact that you and your wife do take the time to carefully. You can't push it. You can't force yourself into that. But if people are open and they're interested, it definitely can get to that level.
Yeah, we don't, and I echo your clarity with that. We don't push that window. But if somebody, you got to, when you listen, like you're talking about, when you really listen, that perhaps that spiritual component, that essence of who you are, will help guide you on what to do. And it's like the little voice that says to you at 2:00 in the morning, and it's dark and you're in a place you don't need to be. I don't need to be here. I need to get out of here. Everybody understands that. And I think we as clinicians have a gift in that area. If we'll just listen to it, we can guide that person down a pathway. And our mission statement that we have within our institute is leading people down a pathway of true healing. And that can mean various things for various people. And that's okay. But I want them to experience life in a way that they perhaps haven't had an opportunity to. And we're all about increasing health span and decreasing sick span. And if that means longevity, so be it.
Well, Mike, thank you so much. Or Mark, I'm sorry. I'm so glad that we had this opportunity to speak. And I think there's a definite resonance between what you're doing and what we're doing here at the Riordan Clinic. And I'm hoping there'll be more and more. I think there are more and more doctors that are looking for this more broader type of medicine, because Physician burnout is pretty common these days too, given the structure of how medicine's practiced. And so a lot of doctors saying, this isn't what I signed up for. I think what we're talking about, if more doctors would investigate it, they would find this is what they signed up for. This is where people can actually be healed, and the doctor can feel like they're really making a huge difference in that patient's life. So, but thank you very much for what you're doing, and thanks for being on our program. Keep up the good work.
Thank you. And thank you so much for having me. I appreciate it.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.